So what is health versus illness? So health is looking at the state of the whole person. So you're going to look at the client's physical, mental, social, and spiritual well-being. Overall, health is not just an absence of illness or disease. And then illness is a subjective experience of feeling unwell. It's how a person is going to perceive and respond to a disease or changes in functioning. So essentially, illness does not equal a disease, though, because a disease is a pathological change in structure or function of the body, and it's typically going to be diagnosed or measured. So a person can have a disease but not feel ill, or they can feel ill but not have a diagnosed disease. So next we have Maslow's hierarchy of needs. So this was developed by Abraham Maslow in the 40s, so 1943. It assesses human behavior and how it's motivated by a series of needs arranged within this hierarchy. So the lower level that is red, those are your basic needs that must be at least partially met before an individual can focus on a higher level need. So this provides a really good framework for prioritizing patient care and understanding what motivates behaviors. We as nurses must be able to assess each patient holistically, and we can do that through recognizing that psychological and social needs also impact recovery and wellness. So this model is utilized for nursing diagnoses, care planning, and setting those goals. So for instance, you have a patient that comes in and is admitted after a car accident with multiple fractures. So how can we address each of these levels? So psychological, we would need to manage their pain, ensure appropriate oxygenation, and maintain fluids for them. Those are those base needs. Then you have safety. So we need to prevent infection, provide a secure environment, Love and belonging, we need to facilitate any family visits if the patient would like that, or phone calls. Then you have esteem. So esteem is going to be when we will encourage participation in certain rehabs and celebrate that patient's progress. And then lastly, you have the very top tier, which is self-actualization. So this is when we're going to help support the patient's goals. So for instance, maybe the patient wants to go back to work after recovery. Well, we're going to help support them in that goal. As nurses, we do need to make sure that their physiological needs are met first prior to moving up hierarchy. So as a whole, health and illness are going to be on a continuum. They do not exist just individually because we can fluctuate between health and illness. So what's an internal variable and an external variable or factors? These are things that can affect either health or illness behaviors. So for this, we have health and health behavior. So what are some internal factors? These are things that are going to be variables within the person or themselves. So for instance, we have developmental stage. The age and level of development influences those perceptions and behaviors related to health. So for instance, a toddler depends on their parents for their safety, whereas an adolescent may take health risks to fit in. So we as the nurse need to adapt our teaching to the developmental level of our patient. Next, you have intellectual background. So their health literacy and understanding can really affect decision making and compliance with their plan of care. So a patient who really understands their diabetes management is going to be more likely to adhere to a care plan. Whereas maybe someone that does not fully understand diabetes management will not adhere. So the nurse, we as the nurse need to assess understanding, which we can utilize teach-back method, which we'll learn a little bit later. And then we make sure that we use plain non-medical terminology. Then you have perception of functioning. How does that patient perceive their physical functioning and how that impacts their health behaviors? So you could have two people with identical chronic pain, and they may view their health completely differently. So we need to make sure that we explore the patient's perception of wellness and not just those objective findings that we find. Then you have emotional factors. So such things as stress, anxiety, depression, or fear really can play an influence on their healthcare choices and compliance and how they perceive their health. So for instance, a patient that is actively having some stress in their life may neglect their diet or medication schedules, becoming more non-compliant. As the nurse, we need to provide emotional support, teach those stress management and coping skills. And then you have spiritual factors. So beliefs and values may influence health practices and decision making. So a patient may be fasting during religious observances or decline certain treatments. So we need to really make sure that we are assessing their spiritual needs, respect their beliefs, and coordinate our care as needed. So then external variables. These are variables that are going to be outside of the person or themselves. So family role and practices. What's their family beliefs on health and behavior will really shape their habits. So for example, a family who values fitness will promote exercise, whereas another patient may rely on home remedies opposed to modern medicine. So it's all that role in their current practices that they're experiencing. So as a nurse, we must assess family influence, engage their family in education when appropriate or as requested by the patient. Then you have social determinants of health. So this is going to be looking at multiple factors. So first you have your socioeconomic factors, such as income, their education and occupation, and really how that's going to affect their care, nutrition, and environment. So someone that has more low or limited income may reduce ability to buy their medications and healthier food choices. So us as nurses, we need to advocate for our local resources, connect patients to community support. Then there's environmental factors within the social determinants of health. So what's their living conditions? Do they feel safe in their neighborhood? Is there pollution occurring where they live? So these are all factors that are going to affect their health. So us as a nurse, we need to assess home and community environments, advocate for safe and clean conditions. And then what's their access to healthcare and their resources? Again, this is under the social determinants of health. So do they have easy access or availability to healthcare? And then what's the quality of the care that they're receiving? And is that going to help affect their prevention and treatment? So for instance, if you have somebody that does not live close to a healthcare facility and they need to have transportation, but they lack that transportation, they don't have their own car and they only rely on public transportation such as buses. Well, is there a bus stop close to that healthcare facility? And if there's not, that may prevent them from obtaining a routine checkup. So this is important for us as nurses to really be able to identify barriers and assist in any referrals and navigation of the healthcare system to ensure that they are receiving the care that they need. Also, it's recommended if you go on to the 211 website, it will provide different services that a patient can utilize and that we can give to the patient. Then you have culture. So different cultures will have different values, customs, and traditions. And so we as a nurse need to provide culturally sensitive care and avoid any stereotyping. And then another factor is social support. So what's their relationships like with their family, friends, and community? If they have a good one, maybe that's going to promote health, whereas a not so great relationship may hinder or vice versa. So as a nurse, we need to encourage the use of social support systems and involve caregivers when possible. And then you have factors that are going to, or variables that are going to influence illness and illness behaviors. So as a reminder, illness is a subjective experience of feeling unwell. This is not a diagnosis or a disease. So this is how that individual is going to perceive and respond to changes in their physical, emotional, or social functioning. So internal variables, again, this is something that the individual is going to shape. So these are perceptions of symptoms, coping skills and emotional state, developmental state, cognitive level of knowledge, spiritual and religious beliefs. So for perception of symptoms, how is that person perceiving their symptoms? Meaning the person assigns that symptom and how it affects how quickly they're going to seek care. So a nurse who is experiencing mild chest pain, they may just attribute it to the stress that they're having during their shift. Whereas an individual with no healthcare background may be experiencing some mild chest pain and they're going to seek care immediately. So we as the nurse need to make sure that we're assessing those patients' interpretations and respond to their symptoms. For coping skills and emotional state, anxiety, fear, depression, or denial is going to really influence the illness response. So a person may withdraw socially or deny illness just due to fear of being diagnosed, quote unquote. So we need to provide that emotional support, teach coping mechanisms, and involve mental health resources if needed. The developmental state, so the age and developmental level, is going to affect that understanding of illness and how to cope. So we need to tailor communication to the developmental stage. Cognitive level and knowledge. So health literacy is going to affect the ability to recognize symptoms and potentially seek care. So as nurses, we need to make sure that when we are educating our patients, we're utilizing simple explanations, avoiding medical jargon, and confirming the patient's understanding. Then you have spiritual and religious beliefs. So beliefs may influence their understanding of illness, the cause, and the treatment. So for instance, a patient may see illness as really a test of their faith or rely on prayer for healing. So us as nurses, we need to respect their beliefs and integrate spiritual support if desired. Whereas your external factors or variables, these are environmental, social, and cultural factors that are going to influence their illness behavior. So visibility of symptoms. Obvious signs of and symptoms will often lead to faster care seeking. So, for instance, a patient has a visible rash, that's going to prompt a quicker like appointments, quicker response within the healthcare team, or subtle fatigue, they might not go seek help. So it's important that we educate about those silent symptoms and early warning signs. Then we have social support and family influence. So family beliefs and behaviors can really promote or hinder care seeking. So as a nurse, we need to, again, make sure that we involve the patient and their family in teaching when appropriate and if the patient would like that. Cultural and social norms. So really, again, culture is going to shape not only health, but how illness is perceived, expressed, and treated. And then you have your economic factors. So financial limitations can really affect the access to care and patients' treatment decisions. So as a nurse, we need to identify those barriers and connect to any community or social resources as needed. And then you have accessibility to health. So how easy and accessible are certain services, transportation and insurance? If they're not easily accessible, that may impact their health and their illness perception. So as nurses, we need to advocate for resources, coordinate any referrals, and follow-up care if needed. So nurses play a key part in promoting health, preventing illness, and educating our patients across the lifespan. So the overall goal is to really help our patient and their families and potentially communities achieve optimal health. So we have health promotion. Health promotion are going to be activities or tasks that enhance the well-being and maximize health potential. So we're going to focus on maintaining or improving their quality of life, and then we're going to ensure positive lifestyle behaviors are being done, and we're going to encourage them to be completed as well to help with that health promotion. So we have passive and active health promotion. Passive health promotion is when the individual or patient receives the benefit of health promotion without actively participating or making any personal behavior changes. So this is really going to focus on more the environmental or policy level actions to help promote health indirectly. So for instance, we would encourage drinking fluoridated water. That's going to help improve dental health without a required action. So a required action would be without brushing their teeth, which we still would encourage, but that's a benefit of drinking fluoridated water. Then you have milk containing vitamin D. That's going to provide individual benefits just by consuming the product. And then, for instance, seatbelt laws or smoke-free environments, that's going to help reduce injury or exposure to smoke and pollutants. So with passive health promotion, health benefits occur without personal effort. Society or system is going to drive those changes. Whereas active health promotion is when the individual will take personal responsibility for adopting and maintaining behaviors that promote health. So examples are exercising regularly, balanced diet and hydration, stress management or meditation, immunizations. So health benefits are really going to depend on the individual's choices, their effort, and motivation. Next, you have health education. So this is a planned, systemic process of teaching patients and or groups of individuals to improve their health knowledge. As nurses, we provide a lot of education in both health and illness. So what's the importance of health education? So why do we educate? We do this to promote informed decision-making in our patients, support independence and self-management within our patients, and then prevent complications and disease progression. So as nurses, we must utilize the nursing process to identify any learning needs, consider those patient literacy, culture, age, and developmental stage factors, and then utilize the teach back in our demonstration to verify understanding. So examples of health education would be teaching a diabetic patient on how to check glucose or educating a patient on their medication side effects. And then you have illness prevention. So this is going to be activities aimed at reducing the risk of developing illness or minimizing its effects once it's present. So really focusing on protecting the patient from actual potential health threats. And there's going to be several different levels of prevention, which we're going to discuss next. So these are the three levels of prevention. You have primary, secondary, and tertiary. So for primary, this is going to prevent disease before it occurs. So P, primary, prevent, P. So that's how you can kind of remember both of these. So, for example, primary prevention is going to include immunizations, health education, seatbelt use, nutritional counseling, physical fitness and exercise. As nurses, we need to provide information and advocate for policies, and then promote immunizations and safety. Then you have secondary prevention. So this is used and done to detect and treat disease early to prevent complications. So I like to think of this as screening. So the S in screening is secondary. So for example, this is going to be blood pressure screenings, mammograms, because we're screening for breast cancer, cholesterol checks, colonoscopies. So us as the nurse, we need to conduct assessments and screenings and provide those early interventions. Tertiary prevention, this I try to think of teach or treat. They both start with T for tertiary. This is when we're going to minimize disability and promote rehabilitation after an illness. So for example, cardiac rehab, physical therapy, chronic disease management education are things that we can do. And as nurses, we want to support recovery, teach self-management, and help prevent further complications. Next, you have risk factors. So patients may have certain risk factors for illnesses, diseases. So risk factors are traits, behaviors, or exposures that increase the likelihood of developing a disease or experiencing a negative health outcome. So there's three different types of risk factors. You have non-modifiable, modifiable, and environmental. Non-modifiable are things that the patient cannot change. So their age, gender, genetics, family history, we cannot change those things about the patient. So as a nurse, we need to focus on early detection, screening, and education for those patients that may have non-modifiable risk factors. Whereas modifiable are things that the patient can change. So diet, smoking, drinking alcohol, physical activity, stress management. So as nurses, we need to make sure that we are teaching lifestyle modification and support behavior changes if they are having these modifiable risk factors. And then environmental. Environmental are external conditions or exposures to a person's or within a person's surrounding that increase the likelihood of injury, disease, or negative health outcomes. So for instance, does it affect how we live and what we are exposed to? So for instance, like poor housing, is there lead contamination within the home's paint, air pollution, contaminated water, and then also how, like what we eat. Does an individual have access to food? Is it hard for them to get to a grocery store? They're living in like a food desert. So those would be environmental factors. And then there's impacts of illness and illness longevity. So what are the impacts of illness? So this is behavioral and emotional changes, such as stress and anxiety, depression, hopelessness. Those can alter and potentially increase illness vulnerability. Also the impact on family roles and dynamics. So strong family community support typically promote fast recovery and better adjustments to an illness diagnosis. Impact on self-concept and body image. Is isolation or stigma occurring? These factors can really worsen psychological distress and delayed healing. And then illness longevity, so acute versus chronic. Acute is going to be more sudden onset, shorter duration. It's typically reversible, and it typically will last less than 6 months. So symptoms are abrupt, they increase in intensity and severity. So as a nurse with an acute illness, we want to make sure we're focusing on symptom relief, rapid recovery, and education for prevention. Whereas chronic is going to develop slowly. It lasts typically greater than 6 months, possibly lifelong. It affects the functioning of one or more body systems. And as a nurse, we need to make sure that we're looking at those long-term management, adapting our care, and then lifestyle support. So these are our 3 theories on caring. So you do not need to know specifically each of these theories for the exam, but these are just a good foundational caring models and theories that we have within nursing. So you have the transcultural theory. This was developed by Dr. Madeline Leininger. So she's really the founder of transcultural nursing as a whole. So she believes that care is an essence of nursing, and culture strongly influences care, health, and illness behaviors. Watson's theory was developed by Dr. Gene Watson. This is going to focus on human-to-human connection in nursing. And that care really goes beyond the physical to include emotional, spiritual, and existential dimensions. And then you have Swanson's theory of caring, developed by Dr. Swanson. This is actually was based on a research with women who had experienced a miscarriage and then later expanded across various nursing contexts. So this emphasizes the role of genuine connection in the nurse-patient relationship and providing that holistic care. So the goal is to empower, emphasize, and support our patients on their healing journey. And there's 5 components. So maintaining belief, offering hope, encouraging and validating our patients. Then you have the second one is knowing. So really taking the time to learn about the patient's story, values, and preferences, avoid assumptions, and making sure that we ask open-ended questions. Third is being with. So that would be being emotionally present, sitting at the bedside, showing empathy and genuine presence with our patients. Next, you have doing for. So doing for others what they do for themselves. So providing that comfort, dignity, and safety. And then lastly, enabling. So this is facilitating the patient's passage through life transition and unfamiliar events. So providing information, teaching, and providing educational points, emotional support as well. So this really helps the patients problem solve and plan. Overall, it's just important to know what these theories have in common. We want to care for our patients in a holistic and all-encompassing manner, and we do not simply just treat their illness or disease processes alone. So how do we show caring in the nursing practice? We can be present for our patients, touch, listening, getting to know our patient, getting to know what they spiritually prefer and providing that spiritual caring, relieving symptoms and suffering, involving their family if needed. But then there's challenges to caring. So what are some challenging factors? That may be time constraints, staffing shortages, emotional burnout, and compassion fatigue that the nurse may feel. Cultural and language barriers may provide a challenge, certain ethical dilemmas. Then technology and task-oriented care. So we rely heavily on our electronic health records, alarms, and procedures. So really making sure that we take the time to have that human-to-human interaction and not just simply relying on making sure that we are recording everything in our health record, which while that is important, we also need to make sure that we are doing the one-on-one care with our patient. There may be some organizational policy constraints, and then maybe even some patient factors, like they're resistant to caring, or maybe they have some complex needs. What is the purpose of patient education? It's really to maintain and promote a health and illness prevention, restore health, and facilitate coping. Additionally, patient education is going to help enable self-care and self-management for our patients, improve compliance and adherence, reduce complications potentially, and enhance that patient autonomy. So what are some patient knowledge and education basics that we can help teach our patient? So we can utilize the mnemonic Speak Up. So S is for speak up if you have questions or concerns. So making sure that our patient knows that they have any questions or concerns, that they are able to ask them to you or anybody in their healthcare team. P is make sure that they pay attention to the care that they are receiving. E, educating yourself about your illness. So really making sure that your patient is knowledgeable on what is going on. A, have the patient ask a trusted family member or friend to be their advocate if they do not feel like they can advocate for themselves. K is know about your new medications and why you're taking them. So making sure as the nurse, we are providing the education to them, for them. Then U is use a healthcare organization that you have researched or checked carefully. So really making sure that that patient has done their research and are going somewhere that they feel comfortable in. And then P, participate in all decisions about your care. So for us as a nurse, we can encourage them to be involved and encourage that independence. So these are going to be the basic learning principles. So a patient needs to have a motivation to learn, the readiness to learn, and the ability to learn, and be within a learning environment. So motivation to learn, we need to make sure that we identify any cultural factors, active participation, we include them in their care. And then motivation to learn, we can also do our teach back method. Readiness to learn, do they have a willingness to engage in the learning process? And then some factors that may affect that readiness, are they in a grieving process? What's their physical health status? And attentional set. So for instance, are they having physical discomfort, anxiety, confusion, or their environmental distractions as we're trying to educate our patient? And then ability to learn. Do they developmentally have capability? Are they an adult or child? What's their health literacy? Do they have any learning or physical disabilities or inability to learn? And then the learning environment. So we as nurses can make sure that the setting is well lit, good ventilation, appropriate furniture, comfortable temperature, and that we do provide privacy. So when educating our patients, we utilize the teach back method. So this is actually a nationally endorsed health literacy intervention that verifies the patient's understanding. Again, this is not to test our patients, but rather evaluate their understanding. So we utilize teach back method to improve our communication with the patient, understanding on the patient's behalf, making sure that they do adhere to what we have taught them, and then to provide satisfaction and an increase in their achieving their outcomes. So when utilizing teach back method, we do not ask yes or no questions, such as like, do you understand? Do you have any questions? Typically, a patient's going to say, yes, I understand. No, I don't have any questions. And we're not really assessing their understanding. So instead, we need to ask open-ended questions. So you could say, I want to make sure that I explained everything appropriately and I explained it well. Can you explain in your own words what I just taught you about, just to make sure that I did what I was supposed to? You could also say, we have a lot of things to talk about today. Can you tell me in your own words what we talked about? What is one thing that you are going to do differently from our conversation today? What can I explain more clearly? Do you want to review something more? So these are all different learning styles that a patient may have. So they may be visual, reading and writing learners, auditory learners, and then kinesthetic or hands-on learners. And then you also have that risk of, what if the learner has a low health literacy? So you guys can review this, know those cues and the nursing education that we could provide and how we could provide that nursing education to our patients based on their learning style. So what is ISBAR? So ISBAR was initially created by the US Navy to convey information quickly and concisely. It was then adapted by the World Health Organization to be utilized between healthcare professionals. This is really going to help maintain transparency, organization, and accuracy when providing patient information. So this is your ISBAR rubric. You'll utilize this in clinic as well. So ISBAR stands for Identify, Situation, Background and Assessment, Recommendation. So that is the ISBAR. So identify, you're going to always want to identify who you are, your position or professional title, and then where you're calling from. Within your situation, you really want to make sure that you are introducing your client this time. So what's the client's name and age? What is their chief complaint and diagnoses? And then what is the reason that you are calling? So what's the active problem? Background and assessment is going to include any relevant past medical history, relevant assessment data, and recent interventions for that patient. So did you give pain meds and that's not helping their pain? Those are those recent interventions, things that you as the nurse did, or maybe even the patient's done. Then you have recommendation. So we always want to suggest a potential reason for the condition or suggest interventions. We also want to make sure that we provide, if we're calling, say, a provider, provide a time frame or urgency for the action. So when they need to get there. You know, we need you to come see this patient right now, come see the patient by the end of your shift, etc. And then you want to, if you do receive an order, you want to repeat back all the orders to clarify if needed. So if the physician goes, please start Lasix 20 milligrams IV every 6 hours as needed, then we would clarify that back and read that back to the